Welcome to the town meeting. I'm Dennis Charney. I'm the Dean of the Icahn School of Medicine at Mount Sinai. This is the format we're going to follow this afternoon. I'm going to make a brief introduction of Dr. Tsai, and then Allan Fine is going to give a brief state of the infirmary, and then Dr. Tsai is going to talk about his vision for the infirmary. This is only his first official day. He's after the announcement. He hasn't started yet, so we got to cut him a little bit of slack. And then we're going to open it up for questions. So, we want to spend most of our time answering your questions about what's happening right now and what our plans are for the future. Dr. Tsai was chosen after an intense national search for the next president of the infirmary and chairman of ophthalmology for the infirmary and also for the Mount Sinai Health System. The search committee did a very good job. It was chaired by Mike Marin, our chair of surgery for the Mount Sinai Health System, had representation of major departments, including the infirmary. National search, we sent out flyers and informal communication and national advertisements to get the best candidates we could for this very important position in our health system. And we got a great response. We had applications from leading departments of ophthalmology and eye hospitals from around the country. A good number of chairs of departments applied from outstanding departments of ophthalmology. So it was a tough decision. We had strong internal candidates as well. But ultimately, our top choice was Dr. Tsai for a number of reasons. One, his outstanding background in terms of his education, his background in administration, including most recently as the chairman of ophthalmology at Yale. His experience in research and knowing the future of ophthalmology was very impressive to all of us. And I personally did a lot of due diligence. I've learned a lot about ophthalmology in this search. I've spoken to over 15 chairs of ophthalmology about our candidates, and by far the leading choice that emerged was Dr. Tsai. And thankfully, he was very interested in this job from really the moment we contacted him. So speaking on behalf of the School of Medicine, I know Ken will chime in as well, that we're very excited that he accepted our offer to be the next president of the infirmary and chair of ophthalmology. You may notice he's got a Mount Sinai ID, so even though he's not going to start full-time until September 1st, he's going to be reaching out to many of you to get advice, to develop a vision for the future for the infirmary starting today. So let's start with Allan Fine giving a state of the infirmary, then we'll move right on to have Dr. Tsai talk about his vision, and then we will open it up for questions.
Great, thank you very much. For many of you, you've heard many of these themes throughout the course of the years, but I wanted to just reiterate, I think, a few salient points before Dr. Tsai has an opportunity to talk a little bit about his thoughts in terms of the future. We have a very solid position, a very solid platform. Financially, we are doing very well. Our surgical volume is the highest it's ever been. Our ambulatory surgical volume continues to grow, although we've seen a slight decrease in terms of inpatient volume. Our case mix index, which actually assesses the severity of the cases, has grown. So that's very positive. I think many of you are cognizant of this on the basis of the surgical utilization in terms of the ORs, and now that we have 2 additional ORs. So this is vitally important to the success of this organization. In addition, we have been very aggressive in terms of our growth and our recruitment efforts. This is really something that is key to our future. This is something that really enables us to grow both the faculty practice plans in ophthalmology and otolaryngology, and enable us to also grow the significant voluntary attending base, both of which are critical to really fulfilling the tripartite mission of our institution, which is patient care delivery, research, and teaching. What we also have the opportunity through now being part of the Icahn School of Medicine at Mount Sinai is the opportunity to really extend our presence in the research arena. This is something that will be done through tremendous opportunities for interdisciplinary collaborative research, specifically utilizing the wet labs and basic science opportunities at Mount Sinai, but significantly augmenting really what we want to do here, which is to extend our presence in translational research as well as clinical trials. And with the myriad of pathology that we have, the volume that continues to grow from all aspects of the organization through the clinics as well as the ORs, there's a unique opportunity in terms of being able to do this, because first and foremost, we want to elevate our stature reputationally on a global basis, not just nationally, in terms of the rankings, in terms of ophthalmology, otolaryngology. We are collaborating very closely with Eric Gendon, the system chair of ENT at Mount Sinai. In fact, Dr. Shin and I are leading the strategic planning effort with Dr. Gendon in a couple of weeks. So I think we have a very, very positive future. I wanted to just highlight a couple of other updates in terms of where we're at relative to the growth of this institution. In terms of campus renovation, I think many of you are aware that next month we are beginning a major project to renovate our entire pediatrics area. This will be completed by the end of December. Many of you are aware that we serve probably close to 23% of the pediatric population across all of our specialties. So this is really vitally important to the continued growth. You'll see, for those of you who will be here at the later meeting, we can show you pictures relative to what some of this will take a look at. You've also heard us talk about plans for expansion on this campus, divided into two components. Phase one, which is really renovation of part of the residence building that will allow for additional clinical diagnostic space for the faculty practice plans, clinical research space, an auditorium, which I think many of you will be pleased to know will not be this room. I'll be able to use this for its intended purpose, and we'll really be able to expand. What we have to do is to engage in a level of philanthropy and seek such funding that will enable us to really fulfill the second part of our vision, which is phase two. You've heard us talk about the Lot 60 initiative, which will allow us to really add additional ORs that will extend our capabilities and additional space both for diagnostic and clinical purposes. We also are going to be simultaneously conducting a feasibility to look at the potential of adding additional ORs, specifically on the fourth floor. If that's possible, that will enable us to have a bridge strategy that will allow us to really grow and not be held back in terms of raising the stature and the platform for this institution. A few other final comments I wanted to make as it relates to the visibility of what we're doing as an organization. Recently, we secured a grant through the Lavelle Foundation that will enable us to really provide services starting first in Brooklyn for underserved areas, partnering with a number of community organizations, and working with the elderly population. We also are going to be doing, for the first time, a rather innovative project through funding through Carl Zeiss Meditech, and that is a global web-based educational initiative. We will be offering CME credits. We will be featuring the faculty of this institution and highlighting the surgical trauma capability. We hope that this will become a branded sort of exercise such that these types of activities, combined with our clinical volume, the excellence of our teaching programs, additional research that we want to do, which really further propels us to advance into the future. We have made progress on the EME front. We have gone entirely paperless in the ENT clinics. That went relatively flawlessly. And we also are gearing up, as all of the other institutions are, relative to ICD-10 training and the like, which has been postponed by the government till October of 2015. But nonetheless, we're well positioned in terms of doing that. I want to emphasize as well that one of the contributing factors to the success of this organization is really the relative tranquility between the full-time faculty and the voluntary attending staff, in a sense that both really significantly contribute to and make up the fabric of this organization. And in that regard, we are equally committed to the growth of those who want to be full-time with us, those who want to participate and utilize this institution for the excellence that we provide in terms of patient care, participate in teaching, participate in research, and those are all things that we want to fulfill. Our biggest needs are adding additional space and capacity to satisfy the increased demand that we are achieving, and we have plans in terms of working on that. And those are, I think, really some positive thoughts to keep in mind. I want to thank everyone for all of their efforts, from the medical staff to nursing to anesthesia to all of the ancillary departments, support services, because really without all of you and without all of your support, despite advances that we've done strategically, despite improvements we've made operationally, despite the very positive financial profile that we have, it's really through the hard work, the effort, the commitment, the loyalty that I know all of you possess that have really contributed to the success. So with that, I'd like to turn it over to Dr. Tsai, who I know wants to offer a few observations as well.
First of all, I want to thank everyone for coming. I'm so delighted to be here and to be being part of this storied institution. I mean, I'm delighted to be joining Mount Sinai Health and working under President Davis and Dean Charney, but most importantly, I'm excited to be part of this institution. This is a great institution. Great ophthalmology, great ENT, great plastics, and I hope that you would agree that the vision we should work toward is the best specialty hospital in the world. Not just in the United States, but in the world, because I think nothing less is deserving of an institution like this. Great physicians, great trainees, great staff. I mean, being a chair at Yale, I've recognized that when patients come, the first thing that oftentimes touches them is the compassion and the diligence and the care of the staff, before even the physicians. So I want to applaud all of you. I just want to be part of this. I want to help facilitate things. I want to help raise money so we can do more, and to focus not just on ophthalmology, but ENT and plastics. I'm just delighted to be part of this. I am going to be working. I'm also excited to be working with Dr. Sidoti and Allan Fine. I mean, I've known Paul since we were residents together, and you know, Dr. Walsh did a wonderful job, and all of you in keeping the institution going, and it's been very, very successful. And I'm just here to try to help things along, and if I can help in making this institution even greater for the third century, I'm just happy to be part of it. So with that, I'm very happy to answer any questions. I know that in this time of change, oftentimes it can be very unnerving. I'm just there to say that I'm going to be listening first, because I need to learn from you what's made this institution successful, and then hopefully together we can make this institution better. So thank you.
While you're thinking of your question, I also want to introduce Mark Costigan. He's the head of development for the Mount Sinai Health System, and will be working closely with all of you and your leadership to develop a capital campaign for the infirmary.
I wanted to share with you that when I start in September, I think what we'll be having is we'll have a couple retreats where we together craft a vision and mission statement for this new combined department, and also where we should be going, and also what measures are we going to hold ourselves accountable to for success. I think that's very important, because I think all of us have been in institutions where everyone says number one, but the question is, how do you measure that? And how can you really demonstrate to your colleagues, peers, and patients that you are number one. So I think that's something that's going to take. So I encourage you to start thinking, because in September I think we'll have some sessions where we're going to discuss together how to measure our success.
My name is Tom Moulton. I'm a retinal surgeon here at the New York Eye and Ear. Many of us would like to know, maybe it may be difficult for you to respond, but we'd like to know your future plans, your role that you see for Dr. Sidoti, Dr. Rosen, and Mr. Fine, because they've been a very important part of our program here and what our conception was of our future.
I can answer that. I can answer that because actually, I think in my discussions with Dean Charney, I let him know very quickly that I consider Paul and Allan part of the executive leadership team if I were chosen, because they've done, I think what I would like is for them to continue to add to this institution and really get me caught up. And then I think together we're going to be working, and I know Rich Rosen and I have talked about exciting opportunities in research. So I think that what we're going to do as much as possible is make sure that things run as smoothly as they ever did. And I think I'm going to work with Ken Davis and Dennis Charney to say what else is needed, the support of the Mount Sinai Health System to really enhance things that are happening here. You heard from Allan that the best quarter ever, I guess, in terms of surgeries. And now what we're going to say is, what more can we do? How can we make it even more attractive for more physicians to come here and operate? And that may include, thinking bigger and growing the institution. But I think we'll have to all sit down and see, is this what everyone wants? So
I can add that one of the things that attracted me about Jim was that among all of the external candidates, he seemed to have the best sense of what's great about the infirmary. He knew a lot of the faculty at the infirmary, and I felt that under his leadership, we would be able to build on the excellence that's already here in a way that was not disruptive and would be seamless as you go even to higher heights.
We have a question from the upstairs overflow room. What is the current estimate for the beginning of the Lot 60 construction?
I'll tackle that initially, and then we can find out from Mark Costigan how much money he's raised from all of you when he's no. Just the plans are as follows. As far as phase one is concerned, which we talked about the renovation for the residence building, we know roughly, and this is an estimate, should be in the neighborhood of about $25 million. We know we have the capacity to pay for much of that and to borrow the rest. That would likely be a phased 3-year construction. All of you know, because you lived through this, we do not have the luxury of just shutting down operations and building. So we have to do all of this simultaneously. But we have calculated, based on securing the zoning variances and doing all of the like, that would probably be about a 3-year phased initiative. In response to the question about the Lot 60 initiative or phase 2, we know that will require capital, and that could be in the neighborhood of 75 to 100 million, and that we will not be able to start until we are able to secure that type of philanthropic support that will emanate from a campaign that we'll be undertaking. That likely could take about 5 years. That is why it's critical that we have the possibility of this bridge strategy, which would be to establish some additional ORs in the north building on the 2 floors where we have ORs, because given we're such a regulated state, we still would have to secure certificate of need approvals, and we'd have to be able to document the need. But that would enable us to have the capacity that would correlate with the recruitment and the growth that we are doing. And don't forget, we also have 16 satellite offices geographically dispersed, adding additional offices, And we have several ambulatory surgery centers that are under construction that should be completed within the next couple of months, and one that we're in the process of a syndication. So just as Jim has described, that we want to be able to grow on this campus, it's vitally important that we continue our growth off the campus as well, and that will serve as a mechanism that will allow us to bring in additional tertiary referrals.
You talk a lot about the surgical center, and that's great, but what about the prospect of the clinics themselves? Are they going to grow, and if so, are they going to grow here or going to be elsewhere?
Yeah, I'll address that initially, and then others can chime in. The clinics are vitally important for several reasons. They are, first of all, part of our mission, part of our fabric, part of the history of this organization. Secondly, they are vitally important to the teaching programs from the standpoint of being able to maintain that degree of excellence. We also are certainly looking at the possibility of how we can continually improve efficiencies and the like. So in that regard, we also have limited space in terms of constraints. So I think, there are no plans to disrupt anything as far as the clinics are concerned. I don't know that we're in a position to necessarily grow them at this juncture, but they are a vital component to our success.
Yeah, I think that obviously there's going to need to be really growth that is well thought out and planned. And obviously, we're going to also have a unique opportunity as we design new clinics to try to figure out how to incorporate the new electronic health record system. So I think that with this renovation on the first 6 floors of the residential building, that's where we're going to really have to think about it, plan it thoughtfully. I think we really want more also space for clinical research, because with all the basic science advances that are happening throughout the world, and Mount Sinai Health has a lot of the top researchers in the world. We need to, in ophthalmology, figure out how to take advantage of that. The enormous clinical volume at New York Eye and Ear is an incredible strength, and I've reached out to my friends and partners in Singapore, Hong Kong, because what I've told them is when they bring a new clinical trial, I want them to think of New York Eye and Ear as the first place they land in the United States. I mean, that's the beauty of having a world-renowned institution in New York City. I think we really have to leverage that more. And I will just tell you, I'm not a stranger to New York City. I'm a member of 4 New York societies. You can ask the faculty at New York Eye and Ear. Sometimes they didn't know if I worked at Yale or I worked in New York City, because I was here at New York for the dinners. And the reason I came in is I always learned so much. The vibrancy of the medical community in New York is second to none. But what I knew when I was at Columbia is that New York Eye and Ear was a phenomenal institution, but the one thing we had at Columbia were the basic science laboratories. Now, with this union with Mount Sinai, hey, this should be one of the premier departments of ophthalmology in the country, one of the best specialty hospitals in the world, and working with Eric Jen and Ed Shin, one of the best ENT programs in the country and the world too. I mean, I think the opportunities are endless, and with my good friend Paul Sidoti and Allan Fine to really help me, and I think you'll see a lot of us. And as we reach out to all of you, we want to involve all of you in making this place better. Because if there's one thing I've learned as 8 years as chair, you need everyone's help. If you can't get everyone working towards the same goal, you don't maximize all the benefits of teamwork, partnership, and collaboration. So that's what I'm really honest. We want to hear from you, because I've learned that the folks who are actually doing the work, they have the great ideas. And so we need to really learn from them as to what to do to maximize the potential here.
Hi, how you doing? Joe Benevento, one of the ophthalmologists here. So as far as expanding our clinical and surgical volume here, are there any plans to encourage physicians in other specialties within the system to maintain their ophthalmology patients within the Sinai Health System?
I mean, our goal is to make sure that this becomes the center for all ophthalmology and all ambulatory ENT. So this is the place. So we want to bring everybody here.
Yeah, just to amplify that point, many of you know that we've been working, Dr. Sidoti and I have been working with Dr. Jabs and others at Mount Sinai. So we've actually already started migrating over volume. Some of you may have seen Dr. Searle, Dr. Reed, Dr. Asbell will be starting this summer, and I was just 2 hours ago on the phone with Dr. Tannen, the site director, and we've identified some time for him as well. So we've already started the process of migrating ambulatory surgical volume for ophthalmology. Dr. Shane and I are working closely with Dr. Jendon and others, and the plan is to migrate some ambulatory surgical volume in terms of ENT, both from Mount Sinai as well as Beth Israel. So indeed, as Dr. Davis pointed out, we want this to be the center of that activity because, frankly, we want to be able to emphasize the core strengths of what this institution is able to do, and that allows Mount Sinai as well to be able to expand the presence of additional tertiary capabilities there.
We won't be a successful integrated healthcare system unless we have centers of excellence and we consolidate what we're doing. And nowhere in our system, and hardly anywhere else in this region, is ambulatory ophthalmological surgery and ambulatory ENT done better and more efficiently than here.
Jim, congratulations. We have a very vibrant volunteer faculty here, and they do probably the majority of cases here. Is our plan in the future to make them full-time faculty members and part of the system, or are we going to work with them and try to negotiate?
You are part of the system. We are agnostic. We are agnostic to whether people are voluntary or full-time. We absolutely are. You will make for your own decision whether it's better for you as healthcare changes and the economic models begin to change as to what you are most comfortable with. Mount Sinai has a long tradition of supporting both voluntaries and full-time, and we started off when I was there, at the beginning of the medical school as largely a voluntary faculty. It has not been Mount Sinai's policy, but the economics of healthcare that has driven more and more people to full-time employment.
I would agree with Dr. Davis. I mean, I think that New York Eye and Ear has been successful having a very strong voluntary faculty, and it's really benefited the training programs here. And so I think what I would love to see is that solution works for anyone, regardless of what they decide to do. And that this institution is able to meet their needs and that they continue to feel comfortable bringing their patients here. I think that's the most important thing. I can promise you I will definitely work with the leadership to have a major branding campaign, because I think that, as I was telling them, this is the best kept secret, I feel, in the country. I mean, really, you guys are as good as any top center, and I know that people know about New York Eye and Ear, but I don't think they realize all the great things that are happening every day. I mean, just give an example. Rich Rosen just told me he just finished one of the first stem cell surgery here. And, we need to broadcast that. We need to let people know this is happening every day here at New York Eye and Ear Infirmary of Mount Sinai. So that's one promise I'll make you. We will be marketing this program because I want everyone to be able to say, I work there, I'm proud to be there, I'm very proud if you bring your friends and family there. Because I think that's what we all want to work at, a place that we can feel comfortable really bring our loved ones. So that's something that I'm delighted that I'm going to be working with all of you to really make that even more and more a reality.
Ron, I just want to add one other point for everyone's benefit as it relates to the commitment to the voluntary attending staff as well as the full-time faculty. The best predictor of future performance and activity is what has been done in the past and currently that contributes to the success. So, for example, in terms of assignment of block time in the ORs, which I know to get down to that granular level is very important to everyone, we don't make the distinction as it relates to someone who's full-time or voluntary. It's really based on a meritocracy, based on performance and need. The same as it relates to participation in committees, the same as it relates to participation in the teaching program or in research. So we have tried to make this more egalitarian in nature. Compared to a lot of academic environments, this has less of what is known as a town gown syndrome, of where there's constant friction and hostility. I think just the opposite. So we want to be able to preserve that element because, frankly, this is something that will enable us to not only differentiate ourselves in the marketplace, but strategically be able to allow us to continue to entice top talent, be they voluntary or be they full-time, from all over the country. And indeed, we're doing those sorts of things.
So just to add to this, take a step back for a second and think about the economics of voluntary versus full-time from the point of view of the healthcare system. If we own your practice, suddenly we have to pay for benefits that we're not paying for now. We have to pay for all your overhead that we're not paying for now, and you're already operating here. So what do we gain by that? What usually happens is quite the opposite. People begin to realize, wait a minute, they can run my office a lot less expensively than I can, and they get better rates than I do. So that's why you want to come in. It's not like we're thinking you're a great deal. So think about it. When I say we're agnostic, I mean, I've got to think about the economics of healthcare here. And, you know, it's a funny switch now for what's better for whom.
And my responsibility and role as department chair for the Mount Sinai Health System is to say, look, you know, ophthalmologists affiliated with our department, really, we will be competing against all the other health systems, and we'll win out. Because we've got New York Eye and Ear as that institution that we take our cases to and our patients really respect coming to. So really, I look at it as I'll work as hard to make sure that any ophthalmologist in this healthcare system benefits from being part of this system. I think that's the key, is that, you know, we're going to be successful together. That's how I view it. And then to our ENT colleagues, I would love to work with Dr. Jenden, Dr. Shin, and also plastic surgery. These are critical subspecialties. That's why I come back to the vision for this infirmary. It's not the best eye hospital in the world. It's the best specialty hospital in the world, because we want to make sure that we grow all the programs, and we raise money for all the programs too. So,
while you're thinking, I want to make another comment in response to the question of when do you start on lot 60. The success of the infirmary has been such that there is really no bounds from our point of view on expanding it. There's every reason to do that, and the timeline is often determined by events that have nothing to do with the infirmary. For instance, what will be the cost of money? When can we get money? How quickly can we raise philanthropy? When will you finish a strategic plan that actually makes sense for what this is going to look like? If we could start in 3 years, immediately after you finish phase 1, that's fine. There's really no hindrance here other than what will be the usual delays in doing a deliberative plan and finding the funding for that plan. But, you know, we need to grow this place. It's that successful, and the potential is that great.
What I would add is the importance of the strategic plan, number one, because that forms the framework on how we invest going forward, how we raise the money going forward. And so that needs to be upgraded, and it needs to be inclusive in getting, as Dr. Tsai said, getting input from all the stakeholders at the infirmary. And I look forward, to getting that process going as soon as possible, because that's going to be the framework as we move forward, that we all agree this is the strategic vision to make this the best specialty hospital in the world. And just to add to the branding notion, we're going to not only brand it here in New York, we're going to brand it nationally, because this is a brand that we can take to Florida. We could take to other parts of the country, because the name, the New York the Icahn Infirmary, has already got a lot of stature, and when we add the ingredients that we're talking about today, it'll rise even higher.
And actually, on the international front as well, we're trying to establish a greater degree of visibility there. And we actually most recently have been collaborating with Mount Sinai with some different insurers, and specifically with some patients. There's one particular insurer from Israel at the moment, Harel, that Mount Sinai has a relationship with, and we do, and we look to do this in other parts of the world in a way that we can attract. We're making enhancements to the website and other initiatives. So that's vitally important, because that will not only contribute to the growth and the reputation of the institution, but as Dean Charney points out, really will further, advance our efforts globally as well as nationally.
Because of our size and our reputation, we can be very attractive to insurance companies now. And we're talking to them about centers of excellence. And centers of excellence means that they would preferentially channel patients to these places. So we're working that out too, and we would like this obviously to be a center of excellence for a number of the insurance companies.
This is why also we're spending a lot of time, and you'll hear us talking further about now the entire system working off Press-Ganey scores, because patient satisfaction will be so vitally important at tomorrow's department head meeting. We'll talk a little bit more about that. But the ability for a hospital or a healthcare system to be able to promote clinical efficacy on the basis of measuring outcomes, showing better results, being able to show a higher degree of patient satisfaction are all elements that insurance companies and even employers who are gravitating toward direct employer contracting, business coalitions, and that's why we're placing such an emphasis, because how we can differentiate ourselves will enable us to also secure better rates.
So I want to emphasize that. Pay for performance means two things to the insurance companies, other than price. It means that we provide high patient satisfaction, but we have high quality. And for that reason, we have to put an extra emphasis on quality and CMO and processes that we put in place that assure that we not only have a great reputation, but in metrics that everyone follows, we are as good as anyone or better in the country on quality measures.
Nothing coming from.
Thank you very much, and we look forward to working together.
Thank you.